this is luxury medicine, essentially.
Why are they so expensive?
Exactly.
Your results are who's holding that syringe.
Yeah, something lifts, Botox lowers. If something closes, Botox opens it up.
A unit here, and I don't know if she did any here. Well,
injecting 70 plus people a week.
Yeah. What happens if Botox goes wrong?
Was just throwing around nose filler.
Oh, yes. Oh, my gosh. This is where art meets medicine. Medicine meets art.
A big PSA to the community, to patients, to stop shopping.
Welcome to Fill and Tell, where we spill the tea on all things aesthetics.
We're your hosts. I'm Megan.
And I'm Lauren.
We're here to give you the inside scoop on what goes on behind the treatment room door.
From filler to facelifts, skincare to aesthetic secrets.
We're taking you behind the scenes of the industry with unfiltered conversations, expert insights, and maybe a little gossip along the way.
Okay, welcome back.
Number 2.
Yes. Okay, so we're back and we're really going to get into aesthetics now.
Yes.
I think our first episode was fun and it was a really good get to know me and like where we came from. But now I think we're going to go ahead and just like get into it and start talking about some of the things that patients want to know about, or things that we really feel like patients want to know about, and
a more candid way of saying
exactly.
It. Yeah.
And so today we're going to talk
way?
About the cost of aesthetics.
The hidden cost, what you
don't necessarily see when you check out.
Yes.
But also just kind of like normalizing too, and I get this question a lot, is like how to budget for some of this stuff. Because, you know, I'm thankful that we work this is luxury medicine, essentially, because at the end of the day, it is still medicine. And I think that's important for people to know and understand, but it is a luxury.
It is.
You know, it's a cash business. This is not insurance. And so I think that you don't think about those costs when you're seeing your regular doctor or when you're seeing your dermatologist. You don't think about all of the costs that insurance is covering. And when you come to our office, you do. You have
everything
to.
Is a cost.
You're constantly curious about why is it this much? I mean, we have conversations with patients every single day, consults where we go over prices and we're very transparent about all of that. And I think that that's a good way to kind of like kick it off and just like go more in depth about what all of those costs are.
Yeah. So to start off with, why are they so expensive?
Exactly. I think that the products themselves are expensive.
They are. So
I mean,
literally the cost of
for us to buy it.
To buy it is expensive. So you got to cover that, right? Because it's a business.
I mean, Botox costs for our pricing, right? We get really good pricing right now, but a bottle of Botox costs $530 something.
Right.
It's expensive.
Right.
So but then again, who's holding the syringe?
And I think that's my biggest thing. And I think that's what irks me a little bit. You know, you want to, of course, I have to explain and be kind. And as soon as someone is educated, then they understand.
Yeah.
But when you're trying to nickel and dime your way through luxury medicine, cosmetic medicine, it is a little bit.
It doesn't end up the best.
It doesn't end up the best. Your results are who's holding that syringe.
Yeah.
And so if you went down the road and got, upper face Botox, well, that would look very different than the way we do Botox.
For sure.
We treat by FDA approval of how many units you should get.
And that's at minimum, right?
But what I'm saying is that's usually how much you need or more. And so this whole baby Botox, my last injector put, a unit here, and I don't know if she did any here. Well,
I know.
That doesn't fly with us.
Yeah. So, and I think that that's a big conversation that we have to have with patients, especially when patients are coming from other offices or are new or just finding us, is like, we really do dose very appropriately.
Yes.
When we first started, it was funny because our practice was not. They were completely underdosing.
They were half the dose that you actually should
do. And I don't know why. Maybe that was like just like a fun number for them. 32 sounded good.
Yeah, and I think people get nervous. Like, oh, wow, if 10 units gives me this, how much will the actual 20 units give me?
Yeah.
And if you don't know how to inject it, then you're going to have a bad outcome.
Right. And so getting back to really where that cost comes from. So yeah, the bottle itself is already super expensive. The syringe, the gauze, all of these costs, the building, the lights, like, thankfully we're not necessarily covering all of that, but it is covered in that cost. And then the biggest thing is the technique.
The main takeaway is who's injecting you.
Who's doing it.
Yeah.
I can't tell you, and you have this exact same thing, how many patients come to me and are like, I've never had Botox like that before. Mm-hmm. It's so good. It's just a different feeling, right? Yeah. When you have okay Botox, like, it's fine. It's fine. Right? Like, your wrinkles are gone.
You don't get it. You're not like, you're like, why are all these people talking about this word Botox? Yeah. Who cares? But then when you get it. Yeah. You get it really good from a good injector, and your brows are lifted, your eyes are open, you get this glow about your skin, right. And you're like, oh, I get it now.
So that's really where that shift is, I think. And so a big cost, at least for that, you know, and fillers even more so. Yes. Right? Yes. So Botox is one thing, and I think that's where everyone starts, right? That's where any injector is starting their aesthetic journey. It's like Botox. Sometimes Botox, I think, is one of the hardest things to do.
I agree.
Foreheads are complicated. I mean, through and through, right? It's probably the most complicated area, and then the lower face. So it's hard.
I think Botox is a great gateway drug in a way.
Absolutely.
You know, you don't want to say it like that, but it ends up being so good.
It gets your feet wet too. You get used to it.
And then you trust your injector. Right. And I think that's the main thing, is you are paying for the skill. Of course, you're paying for the syringe and the other things, but the skill and the way they do it is...
And even so, even more so with filler, right? Because complications happen, and Botox complications happen, right?
They do.
Like, we were just talking about Botox complications. Yes, I take care of other people's complications. We have our own complications, and that's not a bad thing, right? Like, you're injecting, I mean, I'm injecting 70 plus people a week. Yep. Like, the numbers add up for a complication to happen, and that's okay. Yeah. But you have to take care of it.
Right.
You have to know what to do, and you have to know how to take care of it. And I think that's where I get frustrated with some people, is that they're not able to necessarily fix it.
The problem that they created.
Exactly. So you got to be able to.
Yeah. Didn't you recently have a patient come to you from somewhere else?
Yes.
Whose lid was like almost dropped?
I mean, it was probably one of the most severe lid
Yeah, I think that's one of the most severe. And what did you do?
So a good friend, you know, a friend of mine reached out, and just like, my mom, she can't open her eye. And so, like, immediately, right? Like,
heart sinks.
Yes. And you're like, okay, what's going on? Yeah. So, and it's rare, but it happens. And so, you know, a little bit of Botox, when we're injecting these, like, 11 lines, right? Those angry lines, you have to be very precise.
Yeah.
You have to know where you're injecting, and you have to be making sure you're using the right concentration of product.
Yeah.
And so if you don't, and you're not, and it happens, like, that's okay. But a little bit of product will get into that eyelid muscle. And that muscle opens your eye up. And so when you get Botox there, you know, I always tell my patients, it's opposite medicine.
Yeah.
If something lifts, Botox lowers. If something closes, Botox opens it up. So if that gets into that muscle, then now they can't open their eyelid.
So what'd you do?
Yeah.
You fixed it?
Yes. And so she's so happy.
Great.
And it is it's scary for patients to have, you know, Botox done on their eyelid. Yeah. Right? Like, it's a frightening place to have a needle coming at your eyeball, but it truly, especially when you have a severe lid ptosis like that, it's the only way that you can really open up their eye.
Yes.
And so we were able to inject her eyelid. It's like 3 units, right? Yeah. Like, it's so small. It's a tiny little amount. And just knowing where to put it, I mean, within a week, her eyes, I mean, I don't think anyone else would know.
Yeah.
You saw the picture.
I saw the photo.
Yeah.
It looks really good.
No one would know that she had any problems.
Yes.
But you got to be able to do that.
Right.
And so her injector that she came from didn't, and gave her some eye drops, which are totally fine, Love Up Neek, but it's only going to open up so much. And she needed like 4 to 5 millimeters of opening.
Yes.
And so the cost, what we're talking about, like, I didn't charge her at all. Like, I wanted to help her. She was a
friend's mom, right?
And of course it takes me time, but like, at the end of the day, I care about patients. And I mean, 3 units is 3 units, right? Like, but you just should be able to handle some of those complications, I think.
Yeah, I think that goes back to what we're saying is discounted Botox, you know, these med spas that are popping up everywhere. I think consumers really need to stop, assess, ask their injectors, like, what trainings have you gone to? Yeah. Like, what happens if Botox goes wrong? And
you look at their Instagram.
I mean, how, like, that is marketing in a nutshell. And so does the injector that you're going to look the way you want to look? And we really focus on trainings in complication management, and I think that's what sets a good injector aside from a great one. It is how to handle those things, and I'm glad that you could do that for her.
So, and I think that, Botox wears off, right? 3 months, it's gone, you're back to normal. There's really, and this will be a topic for another day, Botox poisoning and all these things that are like buzzwords in the, out there right now. But for the most part, like, it's a very safe thing to do because, again, it goes away.
Yep.
Filler is where it really becomes unsafe, though.
Yes.
And you have to really be aware of who's injecting you, and really, can they handle the complication? Because that's where you get into some trouble, right? I mean, we were at a dinner. Remember, we were at a dinner one night and talking to some other injectors. And I mean, a girl who was just throwing around nose filler.
Oh, yes. Oh, my gosh.
And I was like, holy cow. And so I'm just like thinking about one day there is going to be a complication. And like, I hope that she's prepared to deal with that, because
let's talk about
liquid rhinoplasties are huge and they're beautiful.
Yeah, I think that's one of the biggest, one of the riskiest areas, and it actually requires so much less product.
Oh,
so you're doing like half a syringe or less, but the cost of that liquid rhinoplasty is $1,200
easily.
You want to go to someone who's going to charge that, because that means they know what they're doing. Hopefully. Same with lip filler. So we've gotten a lot of pushback. The lip filler that we do is a flat fee. You don't get to pick half syringe, full syringe. Of course, we go through your aesthetic.
We're tailoring to your
your aesthetic needs and your anatomy, but we have a flat fee. And that is because this is where art meets medicine. Medicine meets art. We, again, going back to the luxury,
this is
the luxury medicine.
It's elective. You are choosing.
Yes.
This is a choice.
Yes. So we want the ability to pick the product that you should get,
and
based
sometimes
on your
it's
anatomy.
Like 3.
Yes. And use the correct amount to get you the aesthetic that you're hoping for. And so maybe that's 0.3, maybe that's 0.7, or maybe that's a full syringe. But, doing that flat fee allows us to do that. And so when people come in and they say, I just want a half a syringe, we have gotten past that. Because, again, this is the art of medicine. The art of aesthetic medicine is treating.
That's what we're doing.
Yeah.
And so, with filler comes some serious complications, or it can. And thankfully, we have not had one of those. But the most severe thing is a vascular occlusion and like how to deal with that. And so,
and that, going back to, what this whole thing is about, hidden costs in aesthetics, a complication like that requires, of course, a ton of things like Hylenex and such, but it requires hand-holding.
Time.
It requires on-call 24/7.
Seeing that patient on Saturday, on Sunday, on Monday at 7 a.m.
And that's where those hidden costs come from, too. A liquid rhinoplasty, or when we do these aggressive CO2 lasers. They're, upwards of $1,500, but I'm talking to them every day. I would come in on the weekend for them. We're giving them post-procedure care. And so there's a lot of costs that people don't see. Yeah. But it's only for their benefit.
Right. And the most severe thing that can happen to you is you go blind, right?
From you can
go blind getting nose filler. You can go blind getting forehead filler. You can go blind getting temple filler.
You can.
And it's FDA approved, right? Temple filler is FDA approved now. So, but these are things that you have to be aware of when you're injecting. And then if you're not, blindness is obviously the most severe. Stroke is the most severe. But then, vascular occlusion and ischemia. So losing blood flow to an area. If you get injected with filler and that filler blocks a vessel, you have to be able to get it out.
Yes.
And if you don't, you have serious skin issues, necrosis, wounds, scarring, permanent damage. Yes. So I think that's really where the consumer, the patient, has to be very selective with who they're going to. And so how do we prevent that? Is we go to a lot of trainings. I think that's one thing that we really love doing.
I think the training set us up to hopefully not have complications, because we're constantly choosing the safest approach the less amount, the least amount of filler? How can we get to this result with the least amount of product?
Right.
We don't want to charge for 6 syringes if we only need 4.
Absolutely.
Sometimes you need that, but trainings, how much time that someone puts into all of this. I mean, that goes back to trainings, but
and the cost of trainings. I think it's so funny because we, work with plastic surgeons. My husband's an orthopedic surgeon. Like, they go to trainings that are completely free. They don't charge anything.
Can we just let everyone know how much a training is?
Yeah, $5,000
at least
minimum. We're about to go to a training in May. And so it's what, 5,500, 5,600?
We went to one last year in California that was closer to 6.
6?
Yeah, so
we're spending like $10,000 to $15,000 a year on trainings.
Yes, for me to be a better injector, but also for the safety of my patients.
Yeah.
To give them the best outcome they possibly can have.
Right.
And so when we're sitting here sort of nickel and diming Botox, it just is so far from the actual medicine that we're trying to
we're trying to do.
Yeah.
Yes. And we have training this week.
Yes,
tomorrow. Which will be fun. Oh yeah, it is tomorrow.
Yeah.
So we have training with one of our reps who we love. She's bringing a trainer in, so we'll get to do that. We have a Sci-Time conference that we're going to in a couple of weeks. And then we'll go to this amazing conference, which we'll have to get into and talk about once we get back in May, that I'm so excited for. And I think it'll be a really good networking opportunity, learning from some of these injectors that we really admire.
Yeah.
Some cool techniques, honestly, like a lot of branding and social media, which is huge in our field. So, and I think that will be good. So I think, obviously the bottom line is you have to kind of just go in and accept the price is the price, right? Like, it's a fair market value, right, for the area, for the most part.
Correct. We don't charge, unit per Botox is actually across the board. However, you're probably going to get more units with us because we're going to do it the correct way.
Yeah. But you're also going to get longevity. I haven't had Botox in almost 6 months, and it looks great. Yeah. Because we did 100+ units, and it's perfect.
And we do your upper and lower and the neck and all the things, the things. But
I think that, so biggest takeaway for patients, though, is just to educate yourself, check someone's Instagram, make sure they have some before and afters, make sure they know what they're talking about before you pick an injector. Ask them questions, ask them how they manage complications, ask them, again, like you said, what trainings they're going to, so that you can be, prepared the best. And a big question too is like how to budget. And I think that's something big that I talk to a lot of patients about. I've kind of gotten, I feel like, my consult down almost with some of my new patients and even existing patients of like, make it simple. Get Botox, Dysport, Daxxify. We can get into that another day of all the different neurotoxins, but like, do that 2 to 3 times a year. Get a laser treatment a year. Get a thing of filler a year. You're way ahead of things. Yeah. And that's an easy way to kind of figure out, when can I do it? How do I budget for this?
And then that way, the way we do it, when we give you a year-long plan, there it really is no hidden cost.
No.
We give you this annual plan, write everything down on a calendar so you know your timeline, and that way you can budget for it. And we really try to do that with all new patients. And then, come January of the following year, we both try to do that too. It's like, okay, what are we doing this year?
Right. Or when is your Botox due? We go back to our old patients, and I'm just like, hey, we've been working on a plan for 2 years. Like, we need a new plan now. Like, what are we doing to maintain all of this?
Yes.
So the cost really is in the trainings behind it, the technique behind it. It's not necessarily the cost of the product, or the laser, or whatever it is that we're doing.
Right.
So I think that's a big PSA to the community, to patients, to stop shopping.
Stop shopping.
Stop shopping around.
Stop looking for the discount. I love a discount. We do give discounts sometimes.
Yes, looking for specials, looking for promotions, like
but
an
be
annual
aware.
sale. But like, if something's always on sale, if something costs $7 a unit, huge red flag. Like,
huge
run
red
away.
Flag. Yeah.
Is it FDA approved? Is it from China?
Yeah.
I had that happen. A patient of mine came in, told me, hey, I'm working at this place in, small little town in Georgia, and my injectors or the person that I'm working with is injecting Botox from China. Like she's buying it on the black market and injecting it in patients.
No.
Swear. And I was like, you can't do that.
No.
I was like, A, you're going to get an infection at the least.
Gosh, so many things running through my head.
And she was buying black market filler.
Oh my gosh.
Yeah.
Wow.
And so I couldn't believe, like, you know, I'd heard it
That's
in the
happening.
news.
Yeah.
But I was like, I definitely didn't think that was happening like close by.
Right.
And she even admitted, she was like, well, yeah, I've let her do it before. And I'm like, okay, well, don't let her do that to you. And you certainly should you should definitely like say something to prevent her from doing that and hurting someone else.
Yeah.
So thank you for joining us this week. We liked being able to dive into some of the hidden cost of aesthetics, and we hope you learned something. Follow us on Instagram,
Spotify, Instagram, TikTok,
YouTube.
And YouTube.
Oh, and Apple Podcasts.
Yep. Anywhere you can get your podcast, that's where you can find us.
That's where you can listen to us. So we'll see you guys next time.